Right now, my ICU looks like an absolute war zone. My ICU is over capacity with COVID patients right now, and we just don't, there's no end in sight.
That doctor in Santa Monica, California, unfortunately not alone. Many ERs and ICUs across this country have now filled up as a record 115,000 Americans are now hospitalized and fighting COVID. Things so bad in Southern California that some medical centers in Los Angeles County, they are now drawing up emergency plans in case they have to start rationing care. We now have more than 18 million COVID cases in the states. And as you can see here from the map, the virus, it's everywhere. The darker the colors, the worse the outbreak. Unfortunately, most of the country orange or red. And we now have 320,000 fatalities in our country. That number soaring by more than 2,500 deaths each day. And the number projected to actually go north of that sooner than later. Now, those are the numbers that we also want to put a human face on when it comes to the pandemic. 45-year-old Billy Laredo from McAllen, Texas. He wrote a love letter to his wife in his final days while at the ICU fighting for his life. I want to read now a portion of it. I know I am not always the perfect man I want to be, but I do my best. If I make it through this, I promise to be a better man in God and life and as a husband. If I don't make it, I want you to know that I lived a happy, wonderful life with you and would never have traded it for all the riches in the world. I also want you to be happy and continue to live your life without me with no regrets. Sadly, Billy did not make it. Now that 2 companies have their vaccines approved by the FDA, the race is on to get the shot into as many arms as possible, but also to convince people that these vaccines are not only critical, but they're safe. Dr. Fauci, he got vaccinated today. He's urging other Americans to trust the shot and to take it once they're eligible.
I feel extreme confidence in the safety and the efficacy of this vaccine, and I want to encourage everyone who has the opportunity to get vaccinated so that we could have a veil of protection over this country that would end this pandemic.
Should be noted that many members of Congress are now taking that message to heart and getting shots already. As you can see, that is rare. Well, roughly more than a few feathers, and it's causing some controversy. Some Republicans, they're taking heat for questioning the severity of the virus repeatedly in public, even echoing some of the president's efforts to downplay the virus. But now they're first in line for the shot. 2 people squarely in that group, Republican Senators Joni Ernst and, of course, Lindsey Graham. Plus, amazingly, there are still many people who are still not taking this virus seriously. A conservative student group held 2 large events in Florida last weekend, including one, you guessed it, at Mar-a-Lago, with huge crowds and few, if any, masks in sight. Here a picture of the White House press secretary, Kayleigh McEnany, enjoying the event. And as you can see, nobody's worried about covering their faces or socially distancing. And at a separate event also in Florida and also indoors, Donald Trump Jr. speaking to the crowd and a money cannon, showering people with greenbacks. So you have these competing images of the difficulties this nation in the throes of, the hope of the vaccine, and still those not taking it remotely seriously enough. I want to bring in our guest to discuss Dr. Amesh Adalja. He is senior scholar at Johns Hopkins University Center for Health Security. He's also an emergency medical physician. And doctor, I always appreciate the time. And first off, we've seen with the vaccine, all the promise that it brings. We've heard problems in the rollout, logistical primarily, but also now concerns of a mutated virus here that we're seeing in the UK, but the concern that it may even spread domestically. Talk about the vaccine and also talk about the concerns that, not only have we not seen the end of COVID, but that we might have to deal with a different part of it than we imagined.
So these vaccines are very tremendous solutions to this pandemic. But the issue is it's going to take some time for us to cross that herd immunity threshold with the vaccine. So we still have to really be careful as we move through these next months, because we have, for example, Many people that are going to get infected, many people that are going to get hospitalized, and many people that are going to die before they have access to the vaccine. And that's why we still have to continue to follow the common sense recommendations that we've been talking about from the beginning. I got vaccinated last week, my first dose. I will continue to follow those same recommendations myself as best as I can until I get my second dose, and then continue to follow them. When we talk about this UK strain that everybody is talking about, what's important to know is that viruses always mutate. Not every mutation has any significance, but there are some concerns that this mutation may make the virus much more contagious, not more deadly, but more contagious. But it's important to remember that the same social distancing, the same mask, the same hand washing, that's how we defeat all of these strains of coronavirus. Whether or not the vaccine works, we're trying to study right now. But I do think that when you get a vaccination, you have to remember you get a broad base of immunity, not just one antibody, but many different antibodies, as well as T-cell immunity. So I do suspect that our vaccines, the Pfizer, the Moderna version, are going to be effective against this strain. We're still waiting for the final results from the companies to know that, but I do think this is not going to derail the value of the vaccines.
I know, doctor, that because the vaccine is still labeled on the experimental side, that there is, in effect, an inability to mandate folks from taking it, although everyone has strongly urged people to do that. We got to get to 75, 80% to get to that herd immunity. I'm curious, your fellow frontline workers, have you found, any nurses or anyone else that's been resistant, or has there been unanimity that people can't wait to roll up their sleeves and get the vaccine like yourself?
The vast majority of healthcare workers, I suspect, will get this vaccine and believe in the value and the efficacy of the vaccine. However, there are some physicians, some nurses that I know personally that are very anti-vaccine, that are spreading misinformation and lies about this. And it's very frustrating when you see healthcare workers who should know better, who have the knowledge and the training to understand the value of vaccines, be part of this kind of attack on what really is a great technological solution that will put this pandemic in the rearview mirror. But it is something that we have to contend with, that there are going to be healthcare professionals that will not take this vaccine. And that makes our job a lot harder because people listen to them. And I think that when they speak and they spread lies or misinformation about the vaccine, it has a really, really bad impact. In one of the hospitals I'm on staff at, there's a prominent surgeon, there's a couple of nurses that are just spreading misinformation on social media, which I find very frustrating. And there's really no solution to it because the more you try to engage with them, the more you amplify their wrong message.
At what point is there a technical threshold where it's like the measles, for example? It's not experimental, but it can be mandated. My kids can't go to school if they don't get inoculated. There's different places. My wife works in a hospital as well. You have to have certain inoculations if you work there. It's not a request. It's an order. What has to happen before people have to get this shot if we view, as I do at least, that it's the best interest in public policy for this country?
What we need is more data, longer-term safety data, likely full FDA approval, not an emergency use authorization. And then what the mandate won't really be a mandate on the condition of life, meaning that you have to have it no matter what, but more on condition of employment, where you'll see private employers, hospitals, companies start to say, this is something we require of our employees if you want to work here. And then you may see schools use it as a condition of enrollment if we have a vaccine that's approved for children. Right now, the vaccines are only available age 16 and above, but you could see that in the future, this becoming a routine childhood immunization and used as a school entry mechanism.
In terms of the rollout right now, is it to be expected, doctor, that we're running into the headaches that we have so far because this is really unprecedented, the scope of what we're dealing with? Or, by, late December, should this plan have been more thought out here, and should we have gotten more of these wrinkles ironed out before the point where we tell everybody get ready because you're getting inoculated? Oh wait, we're still short a lot of doses we thought we had.
Operation Warp Speed is one of the bright spots in this pandemic response. And I do think that you have to anticipate when you're doing such a public health endeavor, basically a Herculean effort, you're going to have glitches, you're going to have hiccups, you're going to have the wrong estimates. I think we need to expect that. And that's likely going to be something that we see happen time and time again. I don't think that it's something that we have to fault the program for it. I do think that there is some bureaucracy involved. There are probably some more planning and more support to the states that could have been done. But I do think that this is not going to go off without a hitch. But so far, I think it's been going pretty well. Hospitals have been able to vaccinate healthcare workers fairly easily. We're starting to see the nursing home residents get vaccinated. But I do think that it is going to be challenging. That last mile of turning a vaccine into a vaccination is often the hard part, especially with vaccines like the Pfizer version, which require cold storage, and that's often going to be a challenge for many places. The Moderna vaccine coming online is going to help that, but I do think that you're going to see some kind of stuttering starts and some issues that crop up, and I think that's to be expected.
Some of the concerns we're seeing, and we've seen this before in the spring, at least in isolated areas, that there's such a crush here because the volume of cases going up. We mentioned the introduction to this segment, what's going on in parts of Southern California. Do you think we're going to see rationing care just because it's so widespread right now and, you know, it's hard to have the cavalry come when they have to deal with it in their own backyards? Or what concerns you more? Do you have more remote areas of this country, particularly in rural areas, where it's going to be really hard to get folks vaccinated in a centralized location, particularly with all the storage issues?
Both of these are going to be major issues. So you already see Southern California running out of ICU space, and they are creeping closer to what we call crisis standards of care, where they're unable to offer the level of care that the patients merit. And that's something we try to avoid. That's what flattening the curve is about, is preserving hospital capacity. And the same thing is happening in rural hospitals where they don't have a lot of ICU beds. They don't have critical care, infectious disease physicians. They don't have enough respiratory therapists or staffing, and they can't just expand capacity very easily. And they rely on the city hospitals to kind of take transfers. And some of that is not happening because the city hospitals themselves are worried about their capacity. So I do think that we are going to see hospitals come very close to crisis standards of care. Hopefully we'll never cross that and we won't have to ration care, but I think hospitals need to prepare for that. They need to have plans for that when it occurs. They need to talk to the community that they serve about the fact that this might happen, and that the actions that people take will directly impact whether your community hospital can provide the standard of care that they need, not only for coronavirus patients, but for people with chest pain and strokes and car accidents.
Well, Doctor, as always, thank you for you and the other frontline folks, what you do right now, especially at this chapter of American history, and have a safe and happy holidays for yourself as well. Thank you.
You too. Thank you.
All right, folks, when we come back, we're going to unveil a new segment. It's called Trash by Trump. You can probably figure where we're going with the title here. But what we're going to do is we're going to feature a particular norm that maybe we've taken for granted until the last 4 years that has been shattered by the man on your screen. Well, today we're going to focus, when it comes appropriately enough, to public health and how this administration has put politics over science and have done it during a historic pandemic.